Oh, there we go. I'd like to call the meeting to order. Welcome, everyone. Thank you for attending. Do we have any comments from the public at the moment? There's another chance at the end for comments. All right, I will do roll call. Oops. Oh, there we go. All right. Sorry. LaRon Coleman. Dennis Cohen. Here. Colleen Crossy. Rabbi Benny. Here. Janet Jackson. Here. Ivana Maplanka.
Here from Lake Orion.
Tanisha Moore.
Here.
Michael Spiss.
Present.
Shelley Taub. Dennis Yeager. All right. I believe we have a quorum. All right. I'd like to start with introductions for the new staff members. So they're going to say a little bit about themselves. So first we have a new SUD director, Christy Schmiege.
Hello, everybody. My name is Christy Schmiege, the new director, and just to give you a little bit of background about myself, I come to this position with 18 years of experience as an SUD director for a PIHP, but up in Genesee County. So I'm very familiar with the role and the responsibilities. I've lived down here in Oakland County for 7.5 years and had been working in the provider network and the Detroit Wayne system. So regained some empathy with what providers go through as well. I've worked in the publicly funded behavioral health system my entire career, 30 years. Thrilled to be here. And Christina Nicholas was a good friend of mine, and I'm very delighted to have inherited her wonderful team of staff.
Thank you. And our next new staff member is SUD manager Megan Phillips.
Megan is ill, so she wasn't able to join us today.
All right. Well, we all know Megan from her previous role, which I don't know the exact title of it, but she is a wonderful contribution to the OCHN staff, and we're happy to welcome her in her new role.
Absolutely.
We have a new clinical analyst, Anna Dillaway.
Hello, everyone. I'm Anna Dillaway. Sorry, I have to be different. So I'm the new clinical analyst. My background is I'm a licensed clinical social worker, also certified alcohol and a drug counselor as well. I've been working within the Oakland provider network for almost 10 years now with different providers, and now taking on this role to help individuals and providers as well.
Thank you and welcome. Network analyst, Madeline Shell.
Hi, my name is Maddie Shell. I am the Service Network Analyst. I've been with the team for about 4 months, I think. I also am a licensed clinical social worker, and I have previous experience working with grants and in the provider network as well.
Thank you, Maddie. Nice to meet you.
Thanks.
And finally, program analyst, Tamika Bailey.
Good afternoon, everyone. I am Tamika Bailey. I am the new Substance Use Disorder Program Analyst. This is my 3rd week, and my background is home and community-based services and skilled nursing.
Thank you, Tamika, and welcome. All right, I would like to move up one item to the beginning of the agenda because we have one member who is leaving. Although we would have a quorum after she left, but it's simple just to approve the minutes from the October meeting. And so then we will follow the agenda as normal. So I will do a roll call vote to approve the minutes. Let's see.
Do we need a motion in a second, or no?
Oh, okay, do we need a motion to?
Don't know what formal protocol is. If so, I'll move the minutes from October 2021.
Second.
All right, thank you. Sorry, thanks for catching my, my blunder. LaRon Coleman is not here. Dennis Cohen.
Yes.
Colleen Crossy. Yes. I vote yes. Rabbi Benny. Yes. Janet Jackson.
Yes.
Tanisha Moore. Yes. Michael Spitz.
Yes.
Shelley Taub.
Yes.
Dennis Yeager.
Yes.
Motion passes. All right, thank you. Back to the regular agenda. So updates from the committee whole. Dennis Cohen.
Okay, there it is. I think, can you hear now? Okay. All right. I'm not technologically savvy yet in my life. A couple things. First, we have 3 new board members that joined us in the last couple months, Yvette Woodruff, John Young, and Sarah May. They all bring different skill sets. I know John and Sarah both have children who have special needs, and they are one of the impetus for them being appointed to the board. And I want to thank our county commissioners who are here for approving them in a very timely manner. This is the first time I've been on the board for a year, and this is the first time we've had a full, complete board. So it's all hands on deck now. So that's very good. The second important thing is we're back together, which I think is great. This building is open. The employees are here. There's kind of a rotating schedule of when people come in and out and that type of thing. But we're very pleased that everybody's back in the building, and things are moving along nicely on that. Probably most important for all of us on the legislative area is we still have these 2 bills, 597 and 598, which are sitting on the Senate docket, have not been voted on yet. It would radically and dramatically change the delivery of the services that the network currently provides. So I know that our lobbyists, as well as Dana and members of the board, have all been talking to legislators to make them aware of the impact this will have on a number of communities within Oakland County, not just geographic communities, but the special needs community, the community that we serve with opioid addictions and other maladies. So that's very important. So if you know a state legislator, please talk to them about this. There's plenty of information. Dana's team can provide you with whatever you need on this. I know we just completed at least the information gathering for the needs assessment for the network, so that's ongoing. Something else, near and dear to me, because of my family, is we continue to expand the work with law enforcement agencies in Oakland County with the program that we've set up to assist them and give them tools and skills with respect to dealing with individuals with mental health needs that they may encounter. And also, we do have a pilot program that's going on with 3 communities that provide a healthcare worker on call to assist them on site. The police are still in charge of the scene, so to speak, or the situation, and that has also been progressing nicely. Last but not least, since we last met, as we all know, it was before November when we had the tragedy at Oxford High School. And at every board meeting, we've been getting updates, but more importantly is the work in the field that the network and its providers have been providing services to families, to students in Oxford, and that continues through today. And I've also worked cooperatively with the county. I want to thank the county commissioners who are here and what they've done to make sure that even people who are uninsured will be able to receive services through the network and its providers. So that's very important. So that's just a, little sketch of some of the more important highlight matters that are going on. Thank you.
Thank you, Dennis. That was a wonderful.
There's a question? Yeah.
Oh, I apologize. Colleen?
Where in the process are these 597, 598? Are they Senate bills? Are they?
Oh, I'm sorry. Yes, they're Senate bills.
Okay.
We are getting an update later in the agenda under old business, so I actually had questions too on that, but I'm like, well, wait a second, he's not gonna know. I think our later update is probably gonna have more information on it, so we'll wait for questions on 597 and 598 until Christine Burke goes under old business. Janet, did you have a question?
I do. I just wanted to ask, the 3 pilot communities for the assisting the officers with the mental health issues, could you let us know what those communities are?
If I recall, it was Bloomfield Township, Auburn Hills, and Farmington Hills were the 3 that. Pardon me?
Birmingham.
Oh, Birmingham. I'm sorry. I said Birmingham.
All right. Thank you.
Yeah. And if you need any more information, our team would be glad to provide that to you.
Were there any other questions? All right, now we can move on. I'm obviously want to go through the agenda too quick that I'm skipping questions. All right, so now we move on to treatment updates. PA2 Funding Utilization Update, Christy Schmiege.
All right. The Public Act 2 funds, which as you know are a percentage of liquor tax that each county receives. The prioritization for PA2 funding here in Oakland County for fiscal year 2022 does not differ from what it was in 2021. Our plan for PA2 funding is to support the following services. Recovery, Information Support Education, our RISE Center. The RISE Center has continued to operate and provides a great deal of information to anyone that calls in the community, and they're getting ready to reopen again after COVID and some renovation. Our Sober Support Unit at the Pontiac facility on Telegraph is a very important service. We're one of the only counties that has that, and it's a place where individuals who are intoxicated on alcohol or drugs can come and come down from those substances in a safe location, and they are evaluated for services and then can be referred into our treatment network. So it's an important way that we can help to divert individuals who might have otherwise ended up in an emergency department of a hospital or even in jail. So it's a very important service. Prevention campaigns that target opioid misuse. We have funding for individuals who are underinsured. This is something that is also extremely important. There are individuals who may have insurance, but they're functionally uninsured due to high copays and so forth. So we are able to treat people right away in our continuum of care by providing PA2 funds to some of those individuals. Recovery-oriented activities that wouldn't typically be covered through our other funding sources, such as yoga, acupuncture, more whole health or wellness-related activities. Ensuring there is no wait to access services. Sometimes for our high-end services, withdrawal management, residential, or medication-assisted treatment, there might be times that, again, individuals that have some other coverage, maybe they're a veteran or they have Medicare, or again, maybe a service that doesn't cover everything. Sometimes those individuals might have to wait. If you need withdrawal management, or what we used to call detoxification, subacute detoxification, you need that now. And having to wait for that until your insurance can cover it, that individual might decide they don't want that service anymore, or they might fall through the cracks and have a more serious situation that would develop. We're able, by covering those kind of activities with PA2 funds, to treat people right away when they need it. Funding treatment and prevention activities above and beyond the block grant funds that we receive from the state. So that pot of money is limited. So for our entire array of services, including peer recovery coach services and recovery housing, when we run out of block grant funds, our Public Act 2 funds kick in, and we utilize them for any services that aren't covered. Funding, so that would be potentially all levels of care that we would cover with those funds. And we spend approximately $2.1 million a year on those sources that I just described.
Any questions? Shelley?
I have a quick question. I know that things during the pandemic obviously were at a downturn, and you'll have to forgive me, I don't remember the new name of Cobo Hall. They just changed it again. So, what? Huntington Place. Okay, fine. But the funding that comes from there, is it up, down, or the same, or what? Motel and hotel and convention taxes, that type of thing.
My understanding is that, and I could be wrong and I'll investigate this, but when they rewrote the PA2, the Public Act that distributes these funds, it's not dependent on COBO as it was when it was first developed back in 1985, I think it was. So now PA2 comes from liquor tax, and all of the counties receive it, and it's not tied to the COBO development as it was initially.
Okay, thank you.
All right, I don't see any more questions, so we will go to the MDHHS audit, which also is Christy.
Just to report the good news on that, MDHHS did a comprehensive audit of OCHN back in February, and the good news is that the SUD section, we passed 100%. So I just wanted to let you know that. So great job to the magnificent staff and our provider network.
Wonderful. Thank you for the update. COVID update. The OCHN interview. We have Christine Burke and Vasily Pozios.
Good afternoon, everyone. I am Christine Burke. I'm the Director of Communications, Community Outreach. Dr. Pozios is co-presenting with me today virtually. Dr. P, did you want to start first?
Yeah, sure. Thank you, Christine. So I just want to give a little bit of kind of some background information on our current state with regard to COVID. And then we can get into some of the vaccine efforts that that Christine has really been spearheading through a grant project. So as you are probably aware, the current variant that we're dealing with is a subvariant of the Omicron variant. It's called PA2. That is the subvariant that's most often encountered in the community, although a subvariant of the subvariant is now kind of taking its place. The long story short is that cases are starting to tick up again, but we don't know to what degree we'll face a surge. You might have heard a comment from Dr. Fauci yesterday. He was interviewed on PBS NewsHour, and he said, for all intents and purposes, the United States is transitioning out of the pandemic phase of the pandemic and into an endemic phase. And what he really is saying is that, you know, despite continued transmission of the SARS-CoV-2 virus, because of the fact that a lot of people have been infected, a lot of people have been vaccinated, even these new variants that we're encountering are not necessarily leading to the same kinds of rates of transmission, hospitalizations, and deaths that we saw, you know, as recently as January of this year. So that's good news, but it does mean that, you know, we are going to continue to face new variants of COVID-19 periodically. So the pandemic for the world is certainly not over, but we may be at an inflection point in the United States in terms of how impactful the pandemic is. So, and I want to kind of take a moment to emphasize the impact of COVID-19. You know, for the vast majority of people, they will probably, if infected, do well. There is some concerning data surrounding the effects of being infected by COVID on risk factors for cardiac disease, and that can relate to heart issues, heart rhythm issues, clotting disorders. There was data that came out fairly recently speaking to an increased rate of risk factor, risk for adverse cardiopulmonary events, even in people that had been fully vaccinated who got infected. So still, it's important to try to avoid getting infected if possible. For the SUD population, this is especially important because, you know, all of the data suggests that people who have SUD and also co-occurring serious mental illness are at especially high risk for bad outcomes from COVID-19. And so, you know, we've really been trying to redouble our efforts to make sure that those who have serious mental illness and those who have SUD disorders, you know, if they want to get vaccinated, we want them to get vaccinated, and we're making it as easy as possible for them to do so. And so in our efforts, we partnered with Genoa Pharmacy. And Christine, if you wanted to share a little bit of information on the project, the grant-funded project that you've spearheaded, that Genoa is assisting with, that would be very helpful. And then I can discuss afterwards just some general statistics of where we're at when it comes to our vaccination rates.
I can do that. The grant itself came to us, I think, last summer, and there were a number of variables that were associated with it. In regard to my team, we had 2 activities assigned to us. The first was awareness and education, and then the second was launching the clinics. The first phase actually took place last August. We used the funding that was available to purchase billboards throughout the county, and the way we make those decisions, the criteria, one, we look at our heat maps, those communities where a significant number of people we serve reside, and then we look at the data in terms of number of views at those billboards. What's always for me a really exciting part about the billboards, and most people don't realize when you purchase a billboard and say we purchased it for the month of September, and if no one purchases the use of that billboard in following months, Commissioner Jackson's nodding, your advertisement stays up. So there were a number of billboards that we strategically chose because going in and out of the community of Pontiac with School of Choices, we purchased one that is on Lapeer Road going into Pontiac. So we purchased it in September, and it's still up with that same message, which was targeted specifically to individuals who have substance use disorders. We identified very early on in the pandemic that there was more of a resistance with people who have substance use disorders to receive the vaccine. So that's where some of the impetus of this grant, I think, and project came from. So that part took place in August. And then our procurement team helped secure a contract with Genoa Pharmacy to launch the COVID-19 vaccine clinics on site at our residential service sites. What we did in that instance was had staff on site throughout the month of February distributing information, pre-registering people to receive the vaccine, and then the COVID clinics themselves actually launched in March, and they are scheduled through the end of this year. And to date, we've vaccinated 109 people, which is higher actually than we thought, under knowing the resistance. So every week we have staff who send new flyers to the service sites, make sure they're posted, make sure that people know that the vaccine is available to them and when Genoa will be on site. Do you have any questions about that process?
And if I may, I'd like to share my screen so that I wanted to demonstrate the progress that we've made. I know this is really hard to see, but this is our Power BI dashboard for COVID-19, and one of the things that we're tracking is what percentage of the people we serve are vaccinated and to what degree. So one of the the population that had been the least vaccinated, yet arguably the highest risk for adverse outcomes from COVID-19, was the SUD population. However, they are no longer the least vaccinated. And I think that this is, we can thank the efforts of Genoa and the grant for really bringing our numbers up. Probably, if we look at about 6 months back in time, the number of people receiving SUD services who were fully vaccinated was about 21%. And now it's really hard to see, but it's 31.53%. So we have essentially made a 10% increase in the number of people eligible for the vaccine who are receiving SUD services, and I think that that's very, very encouraging to see. And we hope to increase that number further so that we are in line with at least our average. So people, out of all people receiving services through OCHN, our number of people fully vaccinated is at 45.49%. So I think our first goal is if we can close that gap, that would be great. And then we're working to try to close the gap with the general population in the state of Michigan as well. So in summary, this is a long-term, kind of game. People have a lot of hesitancy to getting vaccinated, and so it's going to take a lot of effort and time to break that down, but we're making progress. So I'm very pleased about that. Also, if the group has any questions that are COVID related, I'm happy to try to answer them as well.
Thank you. That was a great update and very reassuring. At the beginning of the pandemic, it was a lot of low numbers getting people with SUD vaccinated. So it's great to hear that the numbers are going up now.
Yeah.
Do we have any questions? Janet?
Okay. Fully vaccinated, is that 2 shots and 1 booster, or is it going to be 2 shots and 2 boosters? What's the definition, and is it changing?
The definition of fully vaccinated remains 2 shots. To be considered up to date now for most people, that would be 2 shots, the initial series, and 1 booster. And then for folks of a certain age, it would be that additional booster as well. So, for essentially for reasons related to language that was in the CMS vaccine mandate, they didn't want to change the definition of what fully vaccinated meant, so they're going with the term up to date to mean you've received every vaccine that's been offered to you. The real protection against the Omicron variant comes with that booster shot that you get after the initial series. And so, obviously we're going to be working on getting folks boosted as well when it comes time to do that, because that is going to be a really vital strategy to ensure protection going forward. So as you can see, this is an ongoing effort. This is something we're going to probably be working on for the foreseeable future.
All right, I don't see any other hands up. Was that the end? Yeah, well, that was a very thorough report. All right, so the next item is COVID positive residential. Megan is supposed to report. Did she have a replacement? Okay, Christy.
Thank you again, Madam Chair. Our COVID update within our SUD network during the course of the COVID-19 pandemic, our staff worked closely to evaluate the network needs, the capacity, our abilities to treat individuals with substance use disorders during the course of the pandemic. Our network has continued to adapt and pivot during this unprecedented time, and have had to develop and continue to meet the needs of the people that we serve. Several of our providers conduct COVID testing at the time of admission and also on an ongoing basis throughout the course of treatment. Telehealth services have continued to be available at the outpatient level with in-person sessions available, and persons served are given the choice of which they would like to receive. For individuals that have tested COVID positive and meet criteria for withdrawal management and residential services, we were able to develop a number of options for those individuals. One was a single source agreement with Odyssey House in Flint, and another a single source agreement with Quality Behavioral Health in Detroit, who accepted COVID positive individuals. Withdrawal management services were also provided or can be provided at Pontiac General Hospital that provided space for individuals and have staff that can do that. Meridian Health Services, one of our largest residential providers, they were able to develop quarantine for individuals that were COVID positive so that they could continue to have some groups electronically. We continue to work with our provider network, and they, with community partners, for example, continuing to provide safe housing, recovery housing for individuals through some providers such as Hope Shelter that were able to also develop some quarantine space for COVID positive individuals. So we continue to work closely with our provider network, with Dr. Pozios, to make sure that as the pandemic unfurls and changes, that we're able to meet the needs of individuals in our network that we serve.
Questions? I will say that that was a message of hope to me, that, you know, we're moving beyond the pandemic to, we've adjusted and we've accommodated life as normal. So, all right, moving on, I'm going to guess that Christy's giving the next update, ambulatory withdrawal management programs.
Yes. Ambulatory withdrawal management is an outpatient treatment service. I mean, when you've heard me referencing it as the inpatient level of care that it typically represents, but the ASAM criteria, the American Society for Addiction Medicine, also recognizes an outpatient level for ambulatory individuals. So we, to a large degree, because of COVID, with some specific funds, we're able to focus on creating this service for individuals who, as another alternative for going to a withdrawal management program, if individuals want to be treated at home, this allows that option as well. So the service follows a defined set of medical protocols to provide safe withdrawal from opioids, usually individuals that are mild to moderate cases, and it is more cost-effective and provides this service in the least restrictive manner. Sacred Heart is the provider that agreed, or that is going to be providing this service. Their program that is located in Madison Heights. They have a physician, they have nurses that do telehealth with the individuals in their homes, and also therapists, case managers, whatever other services they need. It is an enhanced program with the goal of treating withdrawal management in this safe, comfortable setting, someone's own home. It is considered an alternative to ASAM level 3.7 that is suitable for situations such as the coronavirus pandemic. Oh, I'm sorry, I already said that. Licensed physicians, nurses, and other integrated services with other providers of care. Individuals can, I think I got ahead of myself, my apologies, they can remain in their home, receive telemedicine, and it's important that individuals who are considered appropriate for this level of care have a strong support system from their family and friends, or an individual wouldn't be considered appropriate for this service. Suboxone is the medication of choice for this service. it's considered, or it's a 5 to 10 day time frame that the service is delivered. Of course, there's an individualized treatment plan, as there would be with any of our other levels of care. And we use evidence-based practices, trauma-informed care. It can be appropriate for individuals with co-occurring mental health conditions. Some of the evidence-based practices that are used: motivational interviewing, cognitive behavioral therapy, dialectical behavioral therapy, mindfulness for relapse prevention, seeking safety for trauma. And the contract is in process, and we are hoping that Sacred Heart can start to deliver these services very soon.
Well, thank you for covering for Megan. That was wonderful. Questions? Shelley?
Yes, I'd like to know if we're going to get a report eventually on what kind of successes they're having with this home program. It sounds like it's awfully, awfully hard for people and for families to go through this. Particularly the first couple of weeks, you said 10 days, give or take. When they're, yes, you have support from your family, but you don't have support from your community, so to speak. So I'd like to know how, maybe in July, if it's up and running, we can get some numbers and stats as to the successes and the amount of, and relapse, if in fact there is. Thank you. Thank you, Madam Chair.
Ms. Taub, we absolutely can provide data. We have staff that are looking at it all the time, and we can make sure we can bring that back.
Yep, I will make sure to get it under old business for the next agenda.
Yes, the goal would be for them to transition to outpatient care, and they could continue to receive telemedicine in addition to receiving their medication through appointments with a physician.
All right, let's move on to the next agenda item, SUD Health Homes. And we have Christy again.
For this one, it's my pleasure to really punt to the team, but this is a new service that we're very excited about, health homes. The focus, we started a behavioral health home here at OCHN a year or so ago, I understand. And the focus of health homes is care coordination and assuring that individuals with substance use disorders that also have physical health conditions receive coordination to assure that they're having all of the conditions that they are experiencing addressed. And Maddie and Tamika are going to go into, Anna and Tamika. All of our team was involved in launching this, but Anna took a lot of the responsibility before we were able to get Tamika on board, so we're very grateful to the entire team that worked on this. But Anna, thank you very much, and Tamika, you ladies take it away.
Good afternoon. Substance use disorder health, often referred to as SUD, is a model of care. It's not an actual home that provides care management and care coordination services to individuals with a substance use disorder. Participation is optional in this program. The individual must be a current resident of Oakland County. And Michigan has 3 main goals for this health home program. improve care management of the individuals and services with substance use disorders, improve care coordination between physical and behavioral health care services, and improve care transitions between primary, specialty, and inpatient settings.
So for their SUD health homes, what makes it slightly different than other of the behavioral health homes currently and other opiate health homes that are out there is that we are funded by state grant funding programs, so that allows us to serve all those who are underinsured, have no insurance, Medicaid, or Michigan Health Plan in all of SUD disorders, not just one particular disorder. We currently have 3 main providers we work with, which is Easter Seals, Oakland Family Services, and Sacred Heart.
Some of the benefits of the SUD health home are improving the individual's health outcomes and long-term recovery, reducing time spent on care coordination, such as appointments and transportation, increasing access to healthcare resources, such as patient and family education, providing patient-centered training, and such as diabetes or nutrition education, and increasing access to community and support services. And one other thing I'd like to add, with a tentative start date of October 1st, we will have an opioid health home that is similar in structure to the SUD health home. The opioid health home is primarily funded by the state grant funding program and Michigan Medicaid. Like the SUD, the individual must be an Oakland County resident and eligible for Michigan Medicaid and have a current diagnosis of an opioid use disorder.
You guys talk too fast for me to take notes. Were there any questions? Colleen?
So I was just wondering, did you start or do you plan to start the opioid health home because the first one was so successful and you have like a overflow, or?
So they're 2 separate programs. The opiate, initially it was presented to us by the state. The way the state designated the rollout of this was based on a priority with the opiate use population, so we were allowed to start one a little sooner. So we started with the SUD health home to open it to all diagnoses. And so the opiate health home is a slightly separate funding and focuses only on Medicaid individuals, so we'll start that program as well to follow state guidelines and separate funding guidelines.
All right, thanks.
Mm-hmm. So yeah, so on the, you could start there, but also with our 3 providers, with the outpatient, I would start there with either Easter Seals, Easter Seals, Oakland Family Services, or Sacred Heart. That's where they would refer you to. I know in the packet we had a flyer, but we should have attached the brochure so you could have some of the more of that information. I apologize. Right, so the way the flyers were made, so each of the providers could have their own flyer, so this is just one of the examples. We're actually currently in the process of making like an OCHN one that has all 3 providers on the flyer as well. We've currently already taken those to Honor Community Health, both in Pontiac General as well as Plum Hollow, and we've met with our access team as well as SSU to start the referral process, and we're actually meeting with our UMUR team as well to start to coordinate as well. Mm-hmm.
All right, well, that was, did you?
Yeah.
You have to hold it down.
You have to hold it down for a very
the first
long
time.
There you go.
Yeah.
Oh, there we go. If I heard you correctly, so 2 separate programs, the SUD health homes are not diagnosis specific, and they're available to people with NRA, people who are underinsured, Medicaid recipients, also Medicare recipients?
Technically, it could be Medicare, because they would fall under the underinsured or no insurance.
Okay, and for the opioid specific, that is limited to Medicaid recipients?
Correct.
So my question is, for Medicare recipients with opioid use disorder problems, can they go to the larger umbrella? Excellent.
That
Thank
is
you.
one of our, for OCH and our values, is part of our goal with this, is that way we could still serve all, and not just limit it to one specific diagnosis.
Thank you so much.
You're welcome.
All right, with no other questions, let's move to, or we covered both of those. Prevention updates, Rachel Rhodes.
Good afternoon. I am Rachel Rhodes, the SUD coordinator, prevention coordinator. So I'm just going to go over a few of our SINAR updates with you all. So SINAR is underway. We just had our second meeting for the SINAR with the state, and MDHHS went over all of the requirements for SINAR and the MRL list, which is the master retailer list as well, and some things to watch out for as we're conducting SINAR this year. So as we are coming to a close on our vendor education period, so the vendor education was March 1st through April 30th. So we're almost at the end of that, where we were able to go to all of our vendors. And so we thank you for allowing us to increase that to meet all of the vendor retailers in Oakland County. In the past, we did about 400 to about 500 vendors. And so this year we were able to increase that. There's about 831 vendors on our master retailer list. And so we were able to do vendor education with all of them, and to provide them the information about Tobacco 21, and then just educating them and getting them ready for when we have SINAR inspections. So quiet period will be May 16th through the 31st. And so that's where no activity is taking place during that period of time. And then we'll start our SINAR inspection, which is June 1st through the 30th this year. So it's for a whole month we will conduct our inspections. And then also this year is a coverage study, and I believe I mentioned that previously before. So the coverage study takes place August 1st through the 30th. And so we will also be participating in that as well, where we have to mark the route that we take for each vendor retailer, and we have to mark it and document all of that and then submit that in a report as well. So do keep in mind that the Youth Tobacco Act is still age 18. The federal law was increased to 21 with Tobacco 21. So the federal law is the law of the land. However, local law enforcement are not able to enforce penalties to those older than 18 until the local law, the YTA, changes. So I do want to keep that in mind. Any efforts that you can help in that will be really appreciated as we're conducting SINARs to make sure that we meet our efforts and our violation retailer rate. Let me see what else. Our DYTUR, which is our Designated Youth Tobacco Use Representative, has met with local law enforcement to educate them on any concerns that we may have, and we have also asked them to help us as we conduct SINAR this year as well. So, any questions regarding SINAR?
Colleen?
Hi, I just have to ask what SINAR means.
Yep, so SINAR is a local or a federal law that was put in place where everyone is mandated to educate and also do inspections with our retailers, our tobacco retailers. So we have to go in and do inspections with them to make sure that they're following the laws and not selling to underage youth tobacco products. Yep.
Janet?
So as someone who sits on an anti-drug coalition within the city of Southfield, we just did the delivery of the packets. And it was strange because a lot of the retailers were saying they had received them in the mail. So was this the first year that there was a dual hit?
So the state does mail them out as well. However, in the past couple of years, they haven't due to the pandemic and some other barriers, but they have been sending them out as well this year as well. So, yeah.
Okay, so
Mhm.
that was normal to see.
Yes.
All right, thank you.
Yeah.
I had a question. I just missed what you were saying. You said that, yeah, Michigan can't find people over 18 yet because, and I missed the reason what you said.
Local law
because-
enforcement cannot enforce that until the Youth Tobacco Act is changed. So right now it's at 18 locally. Federal law is tobacco 21. So once that is changed, then they are able to enforce that.
Is it changed, like Michigan has to pass, no,
Yes.
okay.
Yep. There are Senate bills that are on the table. They do have different packets. However, there's still conversations about that, so nothing has been passed along or approved. Yep.
Thank you.
Mhm.
Let's see, where are we? And so, you covered the site visit, yeah,
Not yet.
okay.
I can cover that.
Oh,
I just want to
okay, you
make
did,
sure.
because I know you talked about it, but not, okay, go
Yep.
ahead.
So site visits have been conducted. I've done 10 out of the 11. I have one more to complete. And all site visits have been found in compliance with the fidelity of the models, except one provider we did have some issues with. And so they were not staying true to the fidelity of the model. So what I did with our prevention coordinators meeting, I did a presentation on what works in prevention and what doesn't work to educate them on that. I did also meet directly with that provider as well to go over some education and direct them back to the developers to develop and to look at something specific for that special population that they're working with. So I am providing technical assistance with them to making sure that they're not producing presentations aside from the curriculum to follow. So that was the only issue that we had with one of our providers. Everyone else has been in compliance.
Thank you. Okay. All right, we already covered old business. No, that was the minute, that was new business. So old business, this is my favorite one. How could I skip this? Updates on Senate Bills 597 and 598, Christine.
Did not know this was your favorite one. No pressure. In regard to Senate Bills 597, 598, which were presented by Senator Mike Shirkey, I also want to add to that on the House side, there are bills that are being presented by Representative Mary Whiteford. While very different in their approach, the outcomes proposed by all of the bills is the elimination of the public mental health system by transitioning funding and oversight of our system to private Medicaid entities. The bills are new this year, however, the threat of privatization really began about 2016 with what we called then boilerplate language 298. Since that time, we've worked very closely with our legislative consultants, with our subject matter experts internally to monitor the bills, to understand the threats to the people we serve, and to make sure that not only are we communicating to the individuals we serve, but we are also helping to advocate based on their choice, which they expressed during work groups that were led by the state, that they wanted their services to remain in the hands of the public mental health system. Concerns that we have, priority concerns, well, there are many, and Dana spends a lot of time meeting with legislators and our community leaders, helping them understand what's the difference, what's the threat. When we talk about our private entity, they are accountable to shareholders. We are accountable to the people we serve. They avoid risk. We seek to identify risks so that we can be responsive. And I think there are a number of other concerns we have, but in delivering that primary message of the harm that can be done to individuals' lives, those are our key points. We do have some talking points that were created for us by the Community Mental Health Association that I would be glad to share with this group. So if you are out and you want to advocate and you need those elevator speeches and some quick data to help with prove your point or discuss your point. And then we also had a video that's very powerful, and it features the people we serve that talk about why this will impact their lives. And I'll make sure that if you have not seen it, I'll get the link to Christy, and it's something that you two could share with your counterparts within your community or anyone you really want to help educate. When we talk about the services within our system, it's so important that we engage our overall community. I sometimes will talk to people when we talk about our system, and we say, if you take the individuals we serve and you give them one friend to be conservative, a family member, a coworker, a co-student, and you really look at the impact and the ripple effect of our services, we touch many more lives than the 23 people we serve directly, and it somewhat equals out to more than half the population of our county. So it's important that those individuals understand this effort and the potential threat to the persons who live in our county. Did you have any questions?
I did. So I've tried to look up when these bills will come in front of the Senate on the the Michigan government website, and it's impossible. How do you get your updates that I could sign up the same way to get updates on this?
It is challenging. So by law, I think that when the bills are going to be presented, they have less than 24 hours. We have to post things. We need much more lead time. We do have a sense from our legislative consultants of when something is going to move. So, for example, in the spring, there was conversation that 597 and 598 were going to come up for a vote. They did not, because at the time Senator Shirkey did not have the votes he needed for it to pass on the floor. They will not go on the floor. I shouldn't say will not, but most likely he's not going to put them on the floor unless he feels he has the votes. A lot of the conversation right now is speculation. So the legislators will be leaving for the summer shortly. What our consultants are thinking may happen, but we continue to advocate because none of it is a guarantee, is that they may wait until the fall to pick up again, or that they will try to push it through on a lame duck. Both Senator Shirkey and Representative Whiteford are terming out this year. So the conversation needs to continue. We need to be proactive instead of reactive in regard to the advocacy. When we hear that they may go on the floor, we traditionally will send out an alert, an action alert right away through our constant contact email list. So our best guess is if somebody says, hey, we hear it's going on the floor. I wish we did have more notice and that we could alert people with some leeway, but that's not the case.
Thank you. Colleen?
I'm just wondering why it's in committee right now, right? So why wait? Why not have people send in letters to their representatives or right now instead of, ta-da, here it is, going up for a vote?
Yeah, we have been doing that ongoing. Some of this, too, it's interesting when you have those conversations in advocacy. There is timing. There's types of advocacy. So we do continue to ask people. We put it in our newsletters. We have it on our social media sites reminding people that this conversation should be ongoing. We have what we call voter webinar for the people we serve, so that they understand that they have a right to vote. They understand that voting is an act of advocacy. So we'll be starting those webinars in May. It is an election year in our state, and making sure that the people we serve understand that their vote is a way to advocate. And we are including information about these acts specifically in those webinars to educate people. We record those webinars. We keep them on our website, and then we send the recordings out into our community as well. So I'll make sure that you guys get a copy of that as well, so you have an understanding of what that message, because to your point, we do have to continue to be proactive. Absolutely.
I don't know if you're on the OCHN email newsletter. I'm on it. I don't know how I signed up, but I do get, so they send out quite periodically, updates on that, and then links to all your representatives to write in. It's very useful. That's how I ended up one time actually getting to the correct place on the
I will do
website.
this. There is a subscription to our newsletters and to our social media sites. I'll make sure we put it on Boardable for this board to have access so that you can be on those different listservs.
All right. Now, new business. We already approved the minutes. Christine, come back. We had already approved the minutes at the beginning. So you are back with the Oxford response.
She said, "Don't go anywhere." I thought, okay. I will give a brief update. I will ask Commissioner Spiz if it's okay, if you have anything to add to this conversation. We continue to work collaboratively with our provider network in response to the Oxford crisis, which with great pride, I always say, our team, our clinical team, and the way they worked with our providers and the way people worked collaboratively was just stellar and really very moving, all heart and with the best intentions to be responsive to the needs of the community, respectful of their culture, and to listen to what they needed to help in their recovery process. We did just complete a report that we've submitted to the state. We have meetings scheduled so that we understand, our providers all have certain areas of expertise, and to make sure that they are working together, they're not being duplicative, and again, monitoring what are those needs of the community. Commissioner Spiz and I were talking shortly after the crisis began, and I want to say probably late December, early January, the district did send out a survey to the community to find out how many families were connected. At that time, it was about 90%. More than 90% of the children returned to school. Most who did not are on a virtual. I learned that the other day from the superintendent. And then last week, we don't have the data from that yet, but it was a follow-up, again, to ensure that families are connected. Our access number, our crisis number, continues to be available on their website. I know over spring break, if families went to the website, if they clicked on the resource link, before they went to the page, a pop-up came up with the access number and with the crisis number that said call. So they really are trying to do their due diligence to make sure people know where, when, and how to get help. I know our access team, if there is a concern, if anyone has a challenge because of private insurance, has just stepped up to make sure they reach out, they connect to people. We do have, through the Board of Commissioners, there was a barrier for people with private insurance. So co-pays, deductibles, we do have that benefit available to members of the community, more than 90 people. I just looked at the list today, so the number of families who have applied for the benefit is over 90. Each one of them are in a different stage of the process and approval. And it really just is verification of, did you get the help in your insurance? Did you have to pay? And just verifying the documents. And they're working with our budget and finance team, and our budget and finance team is working very closely with our access team to ensure that those requests are processed as soon as possible. Did you have anything you wanted to add?
Thank you. And I'd like to thank OCHN and the team for all the good work they've done to help Oxford over the last couple months. We're all trying to fill gaps, so if you hear anything on gaps that need to be filled, one was the private insurance, which we, through the Board of Commissioners, and thank you, Janet, for your support on that, getting that through so that we could help out all those victims and everybody, not only in Oxford, but within the Oxford School District and outside of Oxford, because it does affect everybody. A lot of people just focus on Oxford and put their blinders on, but it's affected people far beyond that school district and will continue to affect them for a long time. So they're going to need our support, not only today, tomorrow, years to come. I think the only other announcement I'd like to make, and I think most here might be aware of it, through some support from the federal government, there's a resiliency center going to be opened up in Oxford. They open the keys, or get the keys, on May 1st, which I think is Sunday, and they'll be there for 3 to 5 years. ongoing support, walk in to help wherever they can help, and they're going to need that support over that time because you never know what's going to trigger somebody. We had the unfortunate incident at Abbey Ridge where one of the fathers was recently shot, and it did trigger a lot of the kids at that time. So thank you again for everything OCHN is doing. I appreciate it.
I just want to add also, and in your packets, we did put in 2 flyers, so, and it is connected to the Oxford crisis because, as Commissioner Spiz mentioned, a number of the children and the families outside, it's just not that community, surrounding communities, but we will be hosting a parent mental health forum in Pontiac at the Bowen Center in collaboration with a number of organizations.
Yeah, and just to add to that, I mean, Oxford School District is a school of choice. I think there's 200 or so students that come in from Pontiac to go to Oxford High School, so, or Oxford Community Schools. So, like I said, it does go far beyond the normal school district size because they're school of choice.
As you know, with that the ongoing assistance that's being provided, it struck me last week. There was some motion before the court that there's a trial and trials that are going to be coming up, which is obviously going to be a trigger for a lot of people. So I think the preparation for that, I'm sure that's been talked about already, but just to voice it, is there'll be a lot of new information that nobody's ever heard of coming out with witnesses and things of that nature in a very public forum. I imagine, Oakland County set up, I don't know if this will be televised nationally. You see these trials on different TV stations. But I just would urge that the planning for that, start to take place now because it's going to be pretty devastating for a lot of people to be hearing and reliving the whole incident. And it's going to be over a period of days. It's not just going to be like a one-day trial, neither one of these. So I would just, make that suggestion.
We are working closely with the federal government, with the victims' assistance, so they do have experience in these crises, unfortunately, in other parts of our country, and so they're providing some guidance specifically to those conversations. I expect they have reference that they'll probably talk to the prosecuting attorney's office. They'll
Right.
keep in close contact with the schools, just to share with them some of the experiences in other communities, those things you want to avoid so that you're not triggering and you're not hindering the recovery. So we will be taking their lead during that phase of this recovery.
Great, thank you.
I just want to say, just the discussion is just leading us to really focus on the collaborative nature that OCHN has put forth as far as joining Oakland schools, law enforcement at this point in time, because we know Oxford was a severe tragedy and will be, but, we're still dealing with COVID with our students in the schools. And this organization has really taken working with us as a Board of Commissioners to really put navigators in our schools as we're trying to put more professionals to look at mental health in our schools. But there's the collaborative nature of these organizations coming together don't always run as smooth as silk, and we know that. And so what we have to do, we have to keep our focus on all of the problems that are out here. And I appreciate Commissioner Spears because sometimes, even as a board, we have some members saying, all this big response for Oxford all of a sudden when we've been having problems in some of our schools all along. But at the same time, just like he impressed to us, it's countywide. We have to really be in a mode where we address people's issues where they stand and where they are. So, but I think Oxford is going to help us see that more, and COVID has helped us see more. So I appreciate the work, Christina. Thank you.
I would just like to add, I think that's reflective of really our leadership. And, it starts at the top and their priorities and their vision for our agency, and not only just in the crisis, but a lot of the initiatives that are now in place. Our leadership had presented prior to Oxford, to your point, and identifying the needs of this entire community. So it has been a organization-wide focus that it reflects the vision of our leadership and our CEO.
And Ms. Lesenby has come before our board several times to give us updates and to keep us abreast on the work. So we truly appreciate that. So thank you. Yes.
I think you're done. All right, I am going to have to apologize to Shelley. She did let me know she was leaving early, and could we move up voting items? But I missed her item that she wanted to talk about, the member stipend. So we will delay that one until next week. So open board positions, we have one more position. This is wonderful. The board is almost full. And it's wonderful to have an in-person meeting again, and almost everyone is here. It's very exciting. And for the open board position, I know we're looking specifically for someone with a religious affiliation, but anyone who has an interest in helping the public with substance use disorders or has them themselves, as I do. That's why I joined the board. I'm in recovery. Please let them know to check out the OCHN website and apply for the position. All right. Yes.
So basically, we're looking for someone with a specific, like, spiritual background? Okay. And then is it also geographically in Oakland County? Do we want to reach out to a certain area in Oakland County?
No, they have to reside in Oakland County, but anywhere in Oakland County.
Okay.
So I don't know that I've ever heard us looking for a specific area.
Okay.
Like Rabbi Benny, that's what, one level of what we're looking at, but we would love to have anyone who's interested in helping out and knowing what's going on and advocating, someone with connections who's worked with recovery, worked with the public.
Great, thanks.
Madam Chair, we can also send out the bylaws, because in Article 3 membership, there's a description of the type of characteristics for board members.
All right, policy board, member issues or announcements.
I should have spoken up earlier, but Shelley did ask me before she left. I believe the last time we met at the end of the meeting after it was over, she brought up this issue of the stipend for members of the committee. And so I think what she was asked me to ask is, the next time we meet, she believes there used to be a stipend and then it was discontinued. And I don't know if there's somebody who could look into that and report back how that could happen if people are interested in that topic. So I think that's what she was going to suggest. So.
Okay, thank you. I wasn't sure if she wanted to actually bring a motion at the time, but I'm glad she told you what her intent was, is to get more information for the next time. All right, perfect.
We'll research it.
Okay, and perfect. Then we can move it up to old business next time. All right, well, I had a question. The board has been gifted with green ribbons, and I should have asked at the beginning, but I don't know if someone could explain to us what the green ribbon represents.
Christine had so many items to address that did not get addressed. So please feel free to wear the ribbons. May is observance of Mental Health Month. And so if you would like to wear the ribbons for the month of May or throughout the year, as you can see, I have mine attached to my badge. So wear it with pride in honor of Mental Health Month.
Yes, I should have been more on it and put mine. Since we're being recorded, I should have put mine on earlier.
Thank you.
And then I had a question, if, does anyone know the recovery celebration date in September? If it's planned yet, scheduled yet, I just want to put it on my calendar, and if you don't need to find it right away. If you could, just bring it to the next meeting, because I'm sure by the next meeting, you're going to start announcing it. Anybody else on the board? All right, I will move to the public. If the public again has the time for comments or questions. All right, well, if there's nothing else, I adjourn the meeting. Or I think I need a motion to adjourn, or no? I think we couldn't decide that last time either. So I'm just going to call the meeting at 2:27, meeting closed. We do? Okay, I know last time we discussed it and we couldn't figure it out. There's motion? Second? All in favor? All right, now the meeting is closed. Thank you.